Spreading diseases and misinformation, anti-vaccine campaigners are blamed for a rise in preventable diseases in the developed world. Why is there a growing mistrust of vaccines? And what's the cure? This is Inside Story. Hello and welcome to the program. I'm Hashem Ahelbarra. Diseases that were once eliminated are back. Preventable illnesses such as measles are spreading, especially in Europe and North America. The World Health Organization and the European Commission joined forces to tackle the issue at the first global vaccination summit. The WHO estimates nearly 20 million infants were not immunized last year. Many of them live in developing countries with poor access to vaccines. But there's concern at a growing movement against vaccines in the developed world.
While in certain parts of the world, people are dying due to a lack of vaccines, here people are risking their lives and those of others by refusing them. Some are playing the prevention game, preferring instead to play with fire.
The World Health Organization says vaccine skepticism is one of the world's 10 major health risks. Health officials say vaccines save up to 3 million lives each year. But in the past 3 years, 7 countries have lost their measles-free status, including 4 in Europe: Albania, the Czech Republic, Greece and the UK. The WHO says the increase in measles is due to the spread of misinformation on social media about the benefits and risks of vaccines. Let's bring in our guests. In Omaha, Nebraska, we have Dr. Ali Khan. He is Dean of the University of Nebraska College of Public Health and a former senior administrator at the U.S. Centers for Disease Control and Prevention. In Brussels, Heidi Larson, Director of the Vaccine Confidence Project, Professor at the London School of Hygiene and Tropical Medicine. And in Lancaster, Derek Gatherer, virologist and lecturer at Lancaster University. Welcome to the program. Dr. Khan, isn't it interesting that we're talking about the growing influence of the anti-vaxxers, not in a desolate country in sub-Saharan Africa, but in some of the most advanced countries in the northwestern hemisphere?
No, not at all. At least in the Western Hemisphere, in some countries, vaccine hesitancy really is a function of public health successes, since people no longer get to see many of these horrific vaccine-preventable diseases, and that allows misinformation to flow and for people to be worried about safety issues or whether they need a vaccine at all. So I'm not surprised at all that we see vaccine hesitancy, at least the version of it we see in the United States and certain other countries.
Heidi, we're talking about countries that have advances in science and technology where you would expect some sense of consensus about the safety of vaccines, but that does not seem to be the case.
Well, the consensus is more in the scientific community and not in necessarily the broader community. Having said that, not all science around vaccines is 100% certain, and that's part of the challenge that we're dealing with. There is a significant amount of science that's quite certain, but there's some level of uncertainty and risk, and that when people, as we just heard, aren't focusing on the threat of the diseases, they shift to the risk of the vaccine.
Derek, if there is this sense of uncertainty about those vaccines, where is the medical community? What is the established authority that should be sending a reassuring message to people?
I think that the authorities are already doing their best to reassure the general population as best they can. The problem at the moment is that more and more people in the developed world are getting their news via unofficial channels. They're using social media applications, they're using general internet searches to get information about things, and they don't necessarily see the public health messages that are coming out there. I also think, as the last contributor mentioned, it's to do with the perception of of risk. I'm sometimes asked if I can guarantee that such and such a vaccine, for instance, is 100% safe. And we can never guarantee that, because no medicine is ever 100% safe. Even something as simple as an aspirin can be deadly if taken wrongly or taken in too high a dose. So it's no more or less safe than many other things that we do in our daily lives, like driving a car, getting on an airplane and so on. These things are not 100% safe either, but many of us do them all the time because the risk is acceptable. And the general population need to get the message that vaccines are an acceptable risk, and that the relative risk of not being vaccinated is actually much greater. If you don't vaccinate your child, then the risk of your child contracting measles and then suffering serious side effects as a consequence is far greater than any tiny risk that there might be from an adverse reaction to a vaccine.
Mr. Khan, this perception that Heidi and Derek were talking about, is it something that has to do with the debate that was launched in the late 90s when a doctor said that there's an established correlation between vaccines and developmental disorders?
To some extent, but that study has been thoroughly debunked, and the author of the study was disbarred from medicine for complete fraudulent publication. So it's part of it, but it's not the whole issue. I see this pretty much as the issue around privilege and potentially white privilege in many cases, where due to the successes of public health, people do not see disease. And as we heard from our esteemed colleague, they don't see the disease. So it's a lot easier now to focus on misinformation, safety issues, and the whole risk perception changes at that point when your child isn't dying of this disease. I mean, just in our generation, parents were lining up to get their kids polio vaccine because they were so scared of sending them out to the pools in the summer because their children would get crippled. You don't see that in the United States anymore. You don't see the effects of diphtheria or measles in the US anymore. And so it's very easy to say, well, why do I even need to get vaccinated? And you're essentially breaking that social contract that we have, that there's some kids who can't get vaccinated. And so to protect our whole community, we have to all get vaccinated.
Heidi, I think to build consensus in a community, you need to, in a way or another, to have the anti-vaxxers on board. However, this is what they would tell you. Doctors, the medical community is creating an environment of fear and describing them as demons. How can you build bridges between the different communities?
Well, I think that the sensationalized media are creating a kind of vaccine populism, in a sense of how they're creating. There's the public, and then there's the elites. But there's actually quite a spectrum of people. In fact, the majority of people are between the two ends of 100% confident and the the serious anti-aggressive efforts, which is a very small but very vocal and sometimes aggressive group. But 80% of the people in the middle, I would say, are asking reasonable questions. So I think it's really important that in terms of building bridges, we don't lose that population, that when they have questions, they're not feeling looked down upon for asking a question, that we make every effort for those who are very much open to questions, open to a discussion, that we engage and we make that extra time that's needed. We need to build a resilience in this group that are sometimes on the fence, because if we don't help build their resistance, they're much more vulnerable to the misinformation that is out there.
Derek, do you have any concerns that if the anti-vaccine campaign continues to build momentum, the very notion of herd immunity would be compromised and we would see diseases that were eradicated come back?
In theory, that's possible for any disease where vaccination simply stops. But in the case of measles, it doesn't take very much of a reduction at all in order for measles epidemics to start taking hold again, because measles is so very, very infectious. It's the most infectious agent that we know, and it has a reproductive factor, which is a statistic we use to estimate the number of cases or the number of new cases that any one case will give rise to, of something like 15. So any measles case will produce another 15 cases in an unprotected, i.e. unvaccinated population. And at those levels of infectiousness, in order to have herd immunity, we have to have extremely high levels of the population vaccinated, well in excess of 90%. Now, currently, at the moment, we're just teetering really on that borderline. Currently in many developed countries. So it's fairly likely that measles will come back. And of course, we have seen the United Kingdom and other countries lose their measles-free status as a result.
The World Health Organization is urging social media firms to do more to combat misinformation on vaccines.
What do you do about it? Well, you start with not giving people false information. And that's really what we're calling for by working with Facebook and Pinterest and Instagram to say, take the false information off. Where there's not scientific facts, take that away. And then, give people a real choice, but a well-informed choice by showing them really what the evidence and the data is.
Ali, we're talking about two different angles of this story, which is the medical aspect, which is convincing people that vaccines are good for their kids and for humanity, and the one which is purely legal about the need to combat misinformation. What do you think should be the top priority now?
So there's a lot of reasons why we have vaccine hesitancy and vaccine misinformation. And I want to go back to our commenter about let's not lose the majority of people in the middle who we can potentially sway to help with better information. I like to start at the point of recognizing that except for this group of vaccine terrorists we see in a number of countries, here in the West, vaccine hesitancy, people love their children as much as anybody else. And if we can approach them from that aspect, and if we can approach them from the trust aspect, we can help get them vaccinated. And helping decrease misinformation by making social media a lot more responsible is absolutely the way to go. In New York City, actually, we started seeing the media being a lot more responsible about their messaging and about social norming, that we get our kids vaccinated because we love our kids. Everybody loves their kids. Let's get them vaccinated.
Heidi, civil libertarians would tell you that liberty comes above safety and security, and that any attempt to contain their rights is an infringement upon basic, fundamental, universal laws.
Well, that's absolutely, I mean, they do have a point. And last July, the UN Office for Human Rights convened an extraordinary commission and rapporteur to look into this because they felt like there were a lot of calls on social media to start restricting all kinds of information, and they were concerned that it would trespass into that line of freedom of expression, particularly in more authoritarian states. But to address this kind of difficult line of mitigating without imposing a kind of consensus or reducing freedom of expression, what the social media companies have done, and I know, and Facebook, for example, has chosen to bring the accurate information up to the top, so and without deleting some of the more ambiguous or negative information necessarily, unless it's extreme and established incorrect. Farther down. So bringing the first thing you see being a card that says, you know, for the best information, go to W.H.O. or CDC or national authorities. But the other thing they're doing, so one is the prioritization to make the easiest access to the best information. And the other is kind of in the back end, they are through changing the algorithms, as it were, reducing what we would call the amplification of risk by limiting how they can, more negative and incorrect information is not replicated.
Derek, now, if we put into place new mechanisms and new laws to prevent social media from being used as a platform to disseminate misinformation, would that be enough? Because many of the anti-vaccine campaigners will tell you, we don't trust our doctors.
I think that that's a defensive measure to try to limit the amount of misinformation that's out there. Also, what we need is an offensive measure that the medical community and the public health community need to take social media much more seriously, and we need to think about how we can become social media professionals. Most of us are not trained as social media professionals. We do a little bit of it on the side in a somewhat amateur capacity, but our opponents, some of the anti-vaccination people, are very sophisticated users of social media, so we have to get up to their speed so that we can fight on a level playing field with them on social media. Another point which was made yesterday at the anti-vaccination at the vaccines symposium in Brussels was that, in fact, some of the anti-vaccination lobbyists aren't really just spreading misinformation, because they know that misinformation can be identified and potentially taken down rapidly. What they're endeavouring to do is simply to spread doubt. So they don't necessarily give out any message that you can point to and say that that's completely incorrect and it needs to be removed. They're just sowing doubt in people's mind, saying, oh, these things are not completely safe, and so forth. And that registers with the general risk aversion of the public. Whereas, in fact, we know that these things are not completely safe, because no medicine isn't completely safe. We have to explain better what the relative risks are and how vaccination is much safer on the whole than risking contracting the disease.
Ali, we have another issue here, which is basically it could be mainly political when you have communities and areas that allow families to opt out of vaccinations without clear medical reasons.
Correct. And there are all sorts of laws underway being revised in the United States to really clamp down on medical exemptions, as they're called, and really limit medical exemptions to when they're definitely necessary. And that's just one of the many public health measures that we can employ to try to make sure that people get vaccinated. If I can just go back to Eric's point, which was really very eloquent. So physicians and nurses actually rank very high for trust. And our experience here in the United States, for example, with HPV vaccine, which has its own set of limitations and misinformation, is that if your physician recommends HPV vaccine, you are a lot more likely to get vaccinated. So we need to use that trust that the medical community has to help reassure people and help them understand how safe vaccines are, and to protect their child, who they also love.
Heidi, I think if you ask anyone in, let's say, in Africa, where I come from, people would tell you if there's any outbreak of any disease, it's just because people have poor access to medical facilities. The debate we're having now is about something which is totally different, a perception among communities in wealthy nations that vaccines are not good. Don't you think that lawmakers themselves should step in and take action?
Well, I think lawmakers should step in where there's kind of criminal behavior, in a sense, and I think that's a very a challenging decision here. I think vaccines are preventing diseases that can kill children and kill adults, as we've seen with some of the young adults who had missed their vaccines as children. But it is not so clearly a divide between this being an issue in Western or more developed countries and not in poorer countries. We have issues in developing countries. The majority of people have a much more tangible, visible sense of these diseases, so they want the vaccines. But where there are marginalized populations or in conflict situations where, for instance, we're trying to deliver the Ebola vaccine, or the thing that's stopping, the final eradication or slowing down the final eradication of polio is because of conflict and the politicization of vaccine campaigns. So there are anti-groups. We've seen WhatsApp and Facebook, social media being used in some contexts to undermine a program that are anti-government. So it's a different type of resistance. But it's true that the population more generally, and what's interesting in the difference is it's the mainstream population that is doubting, more in developed countries, and it's these more politically or other marginalized or other groups in other countries. So this is not just a problem it's a global problem that plays itself out differently and really needs attention. And that phenomena is connected.
Okay. Derek, we've spoken about different angles of this story. What should the pro-vaccine community be doing? What should laws be reinvented? Now, I would like to ask you about the scientific and the medical community itself. Don't you see that in a way or another they are losing this battle with the surge with the anti-vaxxers narrative? What do you think should the scientific community be doing now?
Well, as I mentioned in my last answer, I think that the scientific community needs to get much more serious about taking the fight to the anti-vaccination activists on social media. Mainstream media is great for getting out the message, and we have plenty of opportunities to do that. And I often do it in mainstream television and radio channels, but it's far harder to do that on social media because it's so diffuse and because special techniques are used for really getting the message across in social media. We hear an awful lot, for instance, about YouTube influencers, young people who are on YouTube, who have immense followings, who are influencing young people in all sorts of ways. Most of the time it's about lifestyle choices, it's about fashion and music and so on. But we need to use some of those young people perhaps to get the vaccination message out, because they would be the ideal kind of person to connect with the millions of young people who potentially have not been vaccinated and who need to be vaccinated.
Dr. Khan, ultimately we're talking about families with family doctors. There are GPs around. They go, consult them, they talk to them about those issues. But you get the impression that there's something which is missing here between that practitioner and the families concerned at the same time. This explains why perhaps they're looking for different alternatives.
Correct. And so it's really important to have that relationship with your patients and provide them the best possible information. And again, healthcare practitioners are very trusted in our community, more trusted than their government. And if they're giving out the right message, then you're more likely to see people get vaccinated. So that is one of our strengths, in addition to taking care of all the other things that need to be taken care of. If I may add 2 additional points, so maybe a couple, and you can stop me when needed. I realize this is being taped. So the first is, thank you for starting off with Africa. So let's remember that this vaccine hesitancy in the West is a critical, important, but boutique issue. The bigger issue around vaccinations is getting people vaccinated who need to get vaccinated. 20% of kids aren't vaccinated. We have 1.5 million deaths every year of preventable diseases. So that is the much bigger issue of people who need to get vaccinated, who don't have access to vaccines due to failed political systems. So let's not forget the bigger issue there. And as far as the legal issue is concerned, so we saw in New York City how using public health measures, preventing children from going to school, requiring them to get vaccinated made the difference. And New York City was able to bring a stop to their outbreak by using rules and regulations in addition to other public health measures. So legally, we do have options available to us without restricting patients' rights to make sure that we are protecting our children.
Thank you. Thank you very much indeed. Ali Khan, Heidi, Larson, Derek Gatherer, I really appreciate your time and your insight. And thank you too for watching. You can see the program again anytime by visiting our website, aljazeera.com. For further discussion, go to our Facebook page. That's facebook.com/AJ Inside Story. You can also join the conversation on Twitter. Our handle is @AJ Inside Story. From me, Hashem, Ahelbarra, and the whole team here in Doha. Bye for now.